Hi. Okay, that's wonderful. Hello, hope your lunch was yummy. Hi, I'm Pam Simon, an oncology nurse practitioner and the director of the Stanford Adolescent and Young Adult Cancer Program. I developed the program back in 2015, get to work with wonderful people like Catherine Benedict, and we support the needs of the 15 to 39-year-olds and above diagnosed with cancer at Stanford, both on the pediatric and the adult side, which I think is important, and do a variety of things to include fertility. I'm going to talk today about the clinic level barriers for accessing fertility preservation for patients whose treatments put them at risk for fertility issues, and look at maybe what might help these barriers and what can we do to overcome them. The first one is coordination of care chaos. So the first thing I want to say is, obviously, when patients are diagnosed with cancer, it's very, very complicated, especially breast cancer patients. They have tons of providers, right? A lot of things that have to happen, a lot of things that have to be coordinated. And so that first barrier, coordination of care, it's really about how can we get everyone on the same page, just like we're talking about today. But we're talking about, getting these patients going. What is their diagnosis? What is their treatment going to be? They need scans. They need biopsies. They may not even be in the same hospital and then in the same clinic. And then we're also talking about, making sure that people understand the needs. And so when we talk about fertility, the providers may not even know what to say to patients. How do I get a fertility? It may not be coordinated. Patients don't know to ask. And unfortunately, a lot of this ends up ending up on the patient. And the patient has to be their own advocate, and they don't even know what to do. And so I think understanding just that whole sort of chaos that happens might be helpful in getting next steps to make it easier for patients. We've heard their stories. We hear their stories. That's how I know what I'm, every day what I'm doing is based on what patients have told me and their experiences. And so what can we do to better coordinate that care? If it's before treatment, during treatment, and especially survivorship. All of this has an impact on fertility, whether they do the preservation or not. It's all very important. And I think the second barrier is just that fertility consult. It's very complicated, as I said. And so the patient needs information about fertility in order to make a decision. And the only way to get that is, number one, know what their diagnosis is, know what their treatment's going to be, and then figure out how to move forward from that perspective. One of my patients told me, we don't know what we don't know. And that's so true. So many times I hear, this is the first time anybody talked about this, or I've never even thought about my fertility. And now all of a sudden, in the midst of everything else, I have to think about something like this. And so I think it's really difficult to know. And often there's not standard of care. I think it sounds so easy to put an order into Epic that says, don't forget fertility preservation, but it doesn't pop up at the right times or to the right people. And all of that is a huge barrier. The third barrier is lack of information. And the lack of information can be the providers. They may not know, they may not understand. The fertility people may not understand the oncology systems. They don't. Neither one sort of understands the other system. The patients, as I said, they don't have the information. They don't know. No one knows if insurance is covered. And even if it's supposed to be, is that actually the case? And what are going to be the out-of-pocket costs? How can you make a decision about fertility preservation if you don't even know all of the information, like how much is this going to cost me? And how long is it going to take? People want to start treatment, whether you're the patient or the provider, but we also want to make sure that quality of life and things like that are important, and fertility is one of those. Grants, many of us mentioned grants, and I think understanding what those mean, but that's really easy to send a link to a patient. Here's a grant. How are you going to fill this out? Where do you get the signature from the oncologist and the fertility specialist in order to even put your application in? And so super super hard to just navigate the health system, right? And our oncology, fertility, very busy places. So what's one of the facilitators that might be able to help? A fertility navigator role. And I'm going to kind of talk a little bit about this, but more from my experience. So I sort of became this, this role just sort of became, because I noticed like patients need help. They need help navigating. They need an advocate. So I'm an oncology nurse practitioner, but right now my role is not either in oncology or fertility, but I understand both. And so what I help is try to help the patient. I do the consults, so I can give the information to the patient. They can hear it. I can get them to the fertility clinic as needed. I can help them with the grants. I can help them just kind of navigate that system, but I'm not living in one or the other. I can help create standard of practice. I can help schedule regular meetings between oncology and fertility to talk about these patients, like BMT patients, for instance, right? That we know they're coming up. How can we do this? We also want to make sure that, we give those grant information, that we do all of that sort of stuff. And so it's really important to discuss this before treatment, but like I also said, at that time, I talk about how important it is in survivorship. Let's talk again in survivorship so that we can help answer your questions then as well. The role's not going to fix all issues, but I think having an advocate for these patients that, like I said, understands sort of both sides could really help. My recommendation for policy is develop this role, and for research, include the patient voice in our research and drive everything we do.